Hi everyone, my name is Fanjun Zhou. Today I'm going to give a presentation on my invention, disposable needle remover and receptacle, which is a portable miniature syringe needle remover and receptacle for drug injection users. First, let me introduce myself a little bit. I'm currently a senior student at Newton South High School in Massachusetts, United States. My potential areas of interest are public health and engineering, which are related to what I'm going to present today. The outline of my presentation includes 4 sections. First, the background. Second, related art and past inventions. Third, the invention itself. And lastly, the outlook. Before we get into the invention, let's learn about the background a little bit. So what exactly is drug injection? Well, drug injection is a method of introducing a drug into the bloodstream through a hollow hypodermic needle that is pierced through the skin into the body. Injections like this are typically done into the vein, but injecting drugs under the skin is also becoming popular, which is also known as skin popping, as shown in the picture here. After knowing about the basic information, we might wonder what effect drug injection can bring us, or what kind of harm it may cause. Examples of common types of drugs for injection are heroin, cocaine, methamphetamine, and so on. Injection drug users may face different challenges that normal people wouldn't face, such as additional social stigma, increased risk for infectious diseases, and health consequences of injection drug use, and addiction to the injection process itself. And some other data related to injection drug users indicates that there are about 1 million injection drug users in the United States, and globally around 11 million people inject drugs. In a medical research article, Syringe Disposal Among Injection Drug Users in San Francisco, which was published in March 2011, Lindy Wenger and his research team conducted a visual inspection and a quantitative survey on the prevalence of improperly discarded syringes. Based on the data they collected, they found that 67% of the injection drug users reported improper disposal at some point over the prior 30 days. And 13%, which is 8,000 of the syringes, were disposed improperly among the injection drug users. And a total of 20 syringes were found in 11 neighborhoods. We might wonder where exactly these syringes were found. Well, they could be found everywhere. In a public place, in the trash, down the toilet, or in a sewer or manhole. Additionally, the targeted population is all normal people, including our innocent kids and pregnant women. There was actually a case related to the harm of improperly disposed syringe needles in Australia. An 8-year-old child was pricked by a syringe in playground. The child would undergo months of blood tests, including a screening for HIV, hepatitis C, and hepatitis B. And 8 needles were later discovered in that playground. The father was furious at the perpetrators who abandoned the needles in the playground. He said that, why a kids' park? Of all places to do that, especially this park where my kids and the neighborhood kids are constantly playing. What sort of animal does that? After investigating the factual information, data, and case related to improperly disposed drug syringes, I started to research about what kind of existing solutions we have so far. So let's get into the next section, related art and past inventions. Like we talked about before, syringe needles with drug and medical residues could possibly cause the spread of infections and affect human health conditions seriously. So, in recognition of these risks, the safety devices or safely disposable of the disposable syringe needles is actually mandatory in the United States. As a result, disposable syringes are becoming more universal. According to the North American Syringe Exchange Network, there are about 200 needle exchange programs in 33 states and the District of Columbia. Syringes with auto-disable features or capping mechanism have also been developed, with a majority of two types, mechanical and electronic. However, most needle removal devices on the market are too big to make it hard to carry around, and it's too expensive and unaffordable to injection drug users. Besides, these devices are mostly used in medical places like hospitals or medical institutions. There are also many patents intending to mitigate the drug syringe disposal issue as the list shown on this slide. Let's take two of them to look deeper into. First, the US patent by Johnson aka Means described a pocket-sized remover and receptacle whereby needles and the syringe were broken with a guillotine-like mechanism. However, there are a few disadvantages with this design. First, the configurations of the syringe bottom are various. Next, it's hard to well accommodate the syringe into the device opening to cut the needle short enough to prevent a stubble. Lastly, mounting the metal guillotine onto the plastic box presents another practical difficulty for a cigarette lighter-sized device. Another US patent by Gerald Cooley, Stephen Francis, and their team, they designed a device for unscrewing syringe needles by rotating the entire socket consisting of another pair of pliers. Disadvantages for this design include, first, the complexity of the parts as shown on the second image here can lead to inconvenience in production, and it causes too much trouble for the injection drug users to use. While investigating the existing solutions and inventions, as I described before, there are some drawbacks. As a result, I designed my own invention in the hope to ease the syringe disposal issue. My device is going to follow the SPD target. First, safe. It's necessary to make sure it's safe for the injection drug users to dispose of used syringe needle. Second, portable. The device should be miniature that's easy to carry around and to produce. Third, effective. The device can cut off needles from syringes easily. Fourth, dependable. It could store the syringe needles safely so it won't fall out of the device and hurt others. The overall structure of my device includes two portions, the upper lid portion and the lower box portion. It's a device for capturing and storing syringe needles, includes an upper lid portion mounted tightly onto the lower box portion through an interlock system on the opposing sides of the device. The device is handy, portable, and can be easily put into a pocket purse or supplies kit. In addition, preferably, the interlock system is protruded high enough above the surface so that the user's hand can hold the receptacle behind it to prevent from being hurt by a needle. Let's take a closer look at each of the two portions. There is a vertical cylinder inside the upper lid, which is centered and sits on a rainbow-like anvil embedded in the lower box. After mounting, the portion sits right on the center of the anvil. Ideally, there is a conventional protective cover, which is not shown in the image here, and the use is to cover the cylinder outside to further prevent the broken needles from falling out of the box. In the lower box portion, the anvil has a rainbow-like shape to direct the needle to go along longitudinally when bended. The ammo is made of iron, steel, porcelain, or any materials that are hard enough to collide, bend, or twist needles. Preferably, the anvil has some projected ridges longitudinally, and the anvil is mounted on its slatted base by two inward-rolled hooks on the two opposing sides. Ideally, there is a horizontal cylinder at the bottom of the anvil base, and a magnet is mounted there to attract the broken needles. Also, it's ideal if there is an absorbent on the bottom to absorb drug residue. For the configuration of the device, it generally follows a breaking-twisting mechanism. To break a used needle, we are going to follow the following steps. So first, a disposable syringe after its use is held in one hand, and the needle portion is inserted through the cylinder. After the needle reaches the anvil, firmly push down the syringe against the anvil until the needle is bended to almost a right angle at its root position. Then, the user rotates the syringe on the anvil to twist the needle off the syringe when it is brought contact with either the anvil ridges or at the joining points between the anvil and the cylinder. As the needle is broken, it falls under gravity and magnetic force into the bottom of the box and is retained there. So preferably, the openings between the anvil and the cylinder are big enough for the needle to go through when being bended and extended, while small enough to prevent the broken needles from aligning with the cylinder and dropping out of the device. As a summary, the device is first simple, small, and handy enough. It's mechanical and does not require electricity to use. It's safe for IDU, which is injection drug users, to cut off the needles. And the producer can use a model to easily produce, so it's manufacturable. Last but not least, it's portable and easy to carry around. These are all my presentations for the invention, but what can this invention bring? What is the future? In this drug-infested society, drug injections such as heroin and cocaine are becoming more and more popular. Its rampancy in drug festivals means an increase in dangers faced by ordinary people, especially for vulnerable groups such as innocent children and pregnant women. It seems difficult to stop this poisonous hands of those demons. However, what we can do is to minimize the harm of existing drugs. The needle remover described in this presentation is just one example of how engineering and public health are used to enhance the likelihood that drug injection needles can be effectively disposed. More education and information about the dangers of injecting drugs and improperly disposed syringes needs to be disseminated. May every presentation such as the one I have given today wake up one more drug user who does not handle syringes properly, and may such inventions save one more ordinary people from the potential danger. Thank you for listening. And these are my references for this slide.